We have Westchester County has learned that measles have been confirmed in 8 Westchester County children. 6 of those children are siblings, and all are from northern Westchester. None of the children involved attend public schools or child care programs. They are all private school students. The children's range in age from 6 months to 14 years of age. The Westchester County Department of Health is working with the families and healthcare providers to identify the locations where the children may have exposed others. The children who were not vaccinated appear to have been exposed to measles by attending family events in Rockland County and in Brooklyn, where there have been ongoing outbreaks. Those are the facts as we have it now. I'm going to bring up Dr. Sherlita Amler, as I mentioned, who is our Commissioner of Public Health. She has the authority in that particular position, not only to advise us on the actions that her department will take to deal with this outbreak, but she also has the legal authority to proclaim any type of designation, any type of actions that might follow. It is not the authority of the general government, county executive, board of legislators to make those declarations, and I think that is as it should be. This is a matter where science triumphs over political science. This is a matter of science and medicine and what is the right thing to do to protect the public health. And I would say that we all have our individual rights guaranteed to us under the Constitution. Those personal rights, however, at some point in time cross over and impact the rights of others. And when that happens, then the public health always has to be put at the highest premium. So Dr. Amler will discuss the issues at hand. I'll close off. We'll answer any questions that you have together. And then if you'd like to interview Dr. Amler individually, we'll make sure that that's an opportunity that you have. So Dr. Amler.
Thank you. So good morning. And as our county executive just said, measles has been confirmed in 8 unvaccinated Westchester children. 2 of these who had to be hospitalized as a result of this infection. The children's ages ranged from 6 months to 14 years. And at this time, we are actively reaching out to work with the communities that have been impacted by these cases. The good news is that measles is preventable. There is a highly effective vaccine that works, and it's been used time and time again to stop outbreaks. And the health department is able to provide the MMR vaccine to anyone who needs it free of charge. We currently have vaccine available at our clinics in Yonkers and White Plains, and we will also be bringing MMR vaccine clinics directly to the communities that have been impacted by these cases. I really can't stress enough that vaccination is the key to stopping any measles outbreak. When people choose not to be vaccinated, measles return and outbreaks occur. There are also vulnerable populations that are unable to receive vaccine through no fault of their own, and they rely on herd immunity that routine vaccination provides to the population at large. This includes babies that are less than 1 year of age and those who have certain immunocompromising conditions that put them at risk for contracting measles when vaccination rates in the general public dip. So anyone who is unsure of his or her vaccine status should reach out to their healthcare provider or the last school that they attended. Schools maintain vaccination records for varying periods of time, but that's often a good source if you don't have your old vaccine records. If you are unable to locate your records, it's just best to get the MMR vaccine. A blood titer can be done to determine immunity to measles, but this is a luxury that we really don't have right now because that takes time. So when in doubt, my advice to the public is get a vaccine, get the MMR. It's not harmful to receive additional doses of this vaccine, and it's better to be safe than sorry. You need 2 separate doses of MMR to be fully vaccinated, and these have to be at least 28 days apart in order to be fully protective against the measles. I'd like to just go over the symptom of measles so that people understand, and that would be that symptoms usually appear from about 10 to 12 days after a person is exposed to someone who has infectious measles. The first symptoms can be a fever. That fever can be as high as 103 to 105 degrees. they get a cough, they may have a runny nose, they may have reddening of their eyes or conjunctivitis. They will eventually usually develop a rash, small red dots, and these may be raised. And eventually the dots will coalesce so that the entire person, may have they just look red. And the rash usually appears about 2 to 4 days after the fever begins and the rash can last about 5 to 6 days. The rash will usually begin on the hairline and move to the face and neck and down the hands and eventually to the arms and legs. And you may actually see the rash on the palms of the hands. A person with measles can obviously pass it to others from 4 days before the rash appears through the 4th day that they have the rash. And anyone who has signs or symptoms of measles, we would ask them please to not go directly to a healthcare facility, their doctor, an emergency room, an urgent care, unannounced. Measles is airborne. It lasts in the air for hours after that person leaves the room. So we don't want people going into medical facilities and potentially exposing others. What they should do is contact their physician or the urgent care they're going to or the emergency room that they're going to and let them know what's going on, and they can advise them how they want them to proceed. Healthcare providers who have questions can call us 24/7 at 914-813-5000. And residents who have general questions about measles can call the same number to speak to one of our staff members. And again, that number is 914-813-5000.